It has problems also with the children's rights concept, because what do we mean when we talk about children as the natural resource for the future? Citizens of tomorrow. When we say that children are the citizens of tomorrow, it means that they are not the citizens of today. And measuring if they are the citizens of today or how well their life is today is a much more complicated issue. Now, it's in debate also because society has the right to be interested in its future. Asking a society not to be occupied with what will happen to the society in 20 or 30 years would be unnatural and not smart. So in our project, the compromise we reached was that both perceptions or both perspectives are important. We decided to focus on the well-being because we thought it's the more neglected area. And there's much more indicators and data collections on the well-becoming. Now, all those shifts led to another shift I've described, which is basically what I call from traditional to new domains. Now, if you look into State of the Child reports in the past, you'll see that most of them are divided into a chapter on education, on health, child welfare or social work, basically divided by professions. In the new reports, you are starting to see new domains which are interdisciplinary, cutting across professions, civil life skills, personal life skills of children, and so on. Now, I gave a similar talk a couple of days ago at the psych department at Duke University. And at the end, I had a chat with some of the professors there. And the funny thing, everybody speaks about the importance of interdisciplinary approach until it's come to their own record of publication. Then if you want to be promoted, you need to publish only in your profession or in your discipline journals if you want to be promoted. Also at the Hebrew University, it's not only in Duke, and I would suspect it's true also for the University of Victoria. So the move from this traditional domain, professional domains, to an interdisciplinary domain that puts the child at the center and looks at the child as a whole is a very problematic domain. The same is a very problematic move, very similar to the problematic nature of the shift I described before. Because if you are talking on childhood as a stage of itself, you are basically talking against, even if you don't intend to talk against, but you are going against two of the most influential social theories in the world. One is the developmental psychology and transitions, and we need to prepare children from transition from childhood to adolescence and from adolescence to adulthood. And here we say, no, we don't need only to prepare them, we need to focus on them as children. And the second is socialization in sociology. What is childhood? Childhood is the phase of life where we socialize children and prepare them to be good adults. And the fact that we are talking about childhood stage of itself is a new thing. All of this led to another shift that I'm talking a lot about, and that's what I call the shift from an adult to a child perspective. So when we want to look on children's well-being, and when we want to look on their on beyond survival and positive aspect, there's new questions that we need to ask, and we don't have the answers. We don't know what children are doing. We don't know good enough what children think they need, not what we think they need. What we think they need, what they think they need. We don't know what they have, what they feel. We don't know to whom they are connected or related, and what do they contribute to society. One of the examples I'm always giving is time use. We don't know enough about children's daily activities, where they do it, with whom they do it. Are they doing it in areas designated for children or not designated for children? Are they doing it in safe areas or unsafe areas? Do they like what they're doing or dislike what they're doing? And the only way we could answer those questions is if we'll ask the child himself or the children themselves. And then we stumble into this, one of the most paradoxical things I stumbled on in research, and that's the issue of are children able to be valid and reliable sources of information in studies about their own well-being? Now, what's the paradox? The paradox is in time use, an area I've studied a bit. Whenever you ask children about their time use, the literature is full with caveats and concerns, are they reliable or unreliable, and how did we overcome those issues, and so on. Whenever you study children's time use by a proxy report of their parents, which in some aspect it's a good method, there's not even a mention of the problematic nature of a proxy report of one human being on the other. Now, if I would have done a time use studies on adults and asked the wife to report on the time use of the husband, or vice versa, I would have to write 4 pages of methodological concerns about the problematic nature of proxy report. I might overcome it and do it at the end. But when you do it with children, there's not even a mention of concern. And I invite any one of you to do a literature review of time use studies using adults, parents, and so on to report on the children. It's not even mentioned as a methodological concern. To a degree that even 4 or 5 years ago, when after the welfare reform in the United States, they've done a national survey on consequences for people, and they decided they need to include also children's perspective. But they ran out of budget, so they used what they call them MKA, most knowledgeable adult, to report on the activities and perceptions of their adolescent children. I don't know how many people in the audience have adolescent children at home. I have 2. And believe me, I'm not sure I know exactly what their perceptions and feelings are about things. And it goes beyond that. So another example I have told somebody today was when they looked into one of the arguments against using children was the fact that when people asked children to list the activities they've done the day before and how much time they devoted to it, they came up with more than 24 hours in a day. Said, you see, they are not reliable or valid. What they didn't take into consideration is that children by nature are doing more than one thing at the same time. So it's not that they are not reliable, they understand it different, they act different. And again, from my private experience, my son and daughter, at least the 2 elder ones, whenever they do homework, they play on the computer and they listen to music at the same time. And they would list each of those activities and how much time they've done, and naturally they will come to more than 24 hours. Another shift that is occurring, I think, in the last 5 years, and it wasn't so apparent at least the last couple of years, is what I call the changing geographical focus. If the 90s were the area where everybody published State of the Child report on the national level, then this decade everybody is going to the local level. Even Kids Count is publishing Kids Count on big cities in the United States. And Kids Count is conservative almost as the Federal Bureau of Statistics. But everywhere, in our journal, the last issue was published last week. The one before, in June, was an issue that was devoted to indicators in the local context. In 5 different continents, 5 different countries, studies have looked on indicators of children's well-being in the local context. So that's a new shift, and it goes along very nicely with shifts or changes in the policy. If there is a policy devolution and the welfare state goes, everything is, there is the devolution, the federal, general, national government, depends on which country you are, is shading off or shading away from responsibility and moving everything to the local. And children's most life is in the local setting and affected by the local setting, then we need to adjust our indicators to the local setting and find indicators that will be relevant also to the local settings. And hopefully we are becoming much more policy oriented in the last year. And I think that we are in a stage where we are not only talking about the need to be policy oriented, but we are trying to build those indicators that will be policy oriented. There, again, in the last 5 years, there was, I know, at least of 6 or 7 efforts, to publish guidelines on how to compose indicators and how to use it. The major problem here is that we don't know really good enough how to measure the impact of an indicator. And what really is happening is that a part of case studies, and we know lots of people know how to do good case studies, but case studies cannot be used for generalizing the findings. And we stumble on cases where the same indicator in some instances